cardiologist warns this sleeping position increases stroke risk overnight. It is a startling truth that many individuals remain entirely unaware of the subtle yet profound impact their nighttime habits can have on their long-term health, specifically their risk of stroke. The very posture you adopt as you drift into sleep could be silently, insidiously increasing your vulnerability to a potentially devastating cerebrovascular event, even as your body appears to be resting peacefully. One particularly prevalent sleeping position, adopted by millions for its perceived comfort or sheer habit, has been identified as exerting dangerous chronic pressure on vital blood flow pathways, a risk factor that escalates significantly with age. What most people fail to grasp is that the hours spent in slumber are not merely a period of inactivity. They are a critical window for restoration and regulation, during which the body either repairs and rebalances or, under adverse conditions, experiences heightened strain. In the unfolding narrative, you will uncover the specific positions that medical professionals, especially cardiac surgeons, strongly caution against, alongside practical, life-saving strategies to rectify these potentially harmful habits before their cumulative effects become irreversible and tragic. Dr. Arthur Clarke, a cardiac surgeon with deep expertise in cardiovascular health, delivers a direct and urgent warning. If you habitually find yourself sleeping on your right side, it is imperative that you cease this practice immediately. This seemingly innocuous position, which many perceive as comfortable and natural, may be slowly but steadily constricting the crucial blood flow returning to your heart, night after excruciating night. The profound terror for a cardiac surgeon like Dr. Clarke stems from a chilling statistic. A staggering 30% of all strokes occur not during the hustle and bustle of the day, nor in moments of acute stress, but precisely between the silent hours of midnight and 6 a.m., while you are completely unconscious and vulnerable. Dr. Clarke is poised to unveil a comprehensive ranking of 5 common sleep positions, progressing from merely detrimental to outright perilous. More critically, he will arm you with knowledge of 2 scientifically validated sleep positions that possess the genuine power to profoundly safeguard your brain, starting as soon as tonight. Before embarking on this vital journey of discovery, a brief moment of introspection is requested. Consider your primary sleep orientation. Do you typically rest on your back, your side, or your stomach? Your answer is crucial, as within the subsequent moments, it will become clear whether your established nocturnal habit aligns with the dangerous practices outlined. For individuals over the age of 60, in particular, the insights presented here transition from mere recommendations to absolute, non-negotiable necessities for preserving health and longevity. Let's delve into the specifics, beginning with the 5th position on this critical list: sleeping completely flat on your back, entirely without any elevation. It is understandable why this position feels instinctively natural to many. It aligns the spine in a straight, seemingly neutral posture, and countless individuals staunchly advocate for it. However, the physiological reality of lying perfectly horizontal, particularly as one advances beyond the age of 60, reveals a starkly different picture. In this flat orientation, blood does not merely circulate, it unnaturally pools towards the head. Gravity, instead of aiding the circulatory system in its laborious task of returning blood to the heart, actively works against it, creating a hydrostatic challenge. In the vibrant elasticity of youth, perhaps in one's 20s, the blood vessels retain sufficient flexibility and resilience to adequately manage this gravitational pooling, but the relentless march of time takes its toll. After the age of 60, these once pliable vessels begin to stiffen, losing their vital compliance. The myriad of tiny, delicate arteries nestled within the brain become increasingly fragile, prone to damage under sustained pressure. When blood pools within the cranial cavity for 7 to 8 consecutive hours each night, an insidious pressure begins to build within the skull, a phenomenon known as intracranial pressure. That throbbing, often inexplicable headache that frequently awakens individuals in the pre-dawn hours, perhaps around 3 a.m., is far from a random occurrence. It is, in fact, a palpable manifestation of this elevated intracranial pressure. Your precious brain is quite literally being subjected to a gentle but persistent squeeze by an excess volume of blood that, due to the horizontal posture, cannot adequately drain or recirculate. Pertinent research published in the esteemed Journal of Clinical Sleep Medicine has meticulously investigated this precise phenomenon. Their compelling findings unequivocally demonstrated that even a modest 15-degree elevation of the head during sleep significantly mitigates this dangerous pressure, simultaneously enhancing the crucial return of blood flow back towards the heart. A critical nuance often overlooked by many is the common scenario where an individual awakens feeling disoriented or dizzy. Upon quickly sitting upright, they experience a sensation of lightheadedness, often dismissing it with the resigned thought, "Oh, I'm just getting older." This dismissive attitude, however, misses a vital warning sign. Such episodes are often clear indicators that the intricate blood flow dynamics that should optimally occur during sleep are severely compromised. The corrective measure for this particular issue is remarkably straightforward, and its precise application will be revealed towards the conclusion of this discussion. But before that, it is imperative to address the fourth position, as its implications frequently shock people. The fourth position to avoid is sleeping on your right side, especially if you carry any history of underlying heart issues or high blood pressure. While this may strike some as an oddly specific proscription, a deeper understanding of human anatomy elucidates its profound importance. Your heart, the indefatigable pump of your circulatory system, is positioned slightly to the left of the center of your chest cavity. When you choose to lie on your right side, the sheer weight of your upper body shifts, inadvertently compressing one of the largest and most critical veins in your entire body, the inferior vena cava. This colossal vein is singularly responsible for the monumental task of collecting deoxygenated blood from your entire lower body and meticulously returning it to the heart for reoxygenation. Even a seemingly mild, imperceptible compression of this vital vessel forces your heart to expend considerably more effort, laboring harder to draw that essential blood back into its chambers. For a robust, healthy 30-year-old with a strong cardiovascular system, this additional workload might indeed be negligible, scarcely registering as a concern. However, for an individual over the age of 60, especially one contending with borderline heart function or already diagnosed high blood pressure, their heart is very likely already operating under significant duress, working ceaselessly in overdrive just to maintain baseline function. Now, consider the cumulative impact of adding an extra 7 hours of this heightened workload night after relentless night. The implications become alarmingly clear. Cardiologists have observed a telling pattern. Patients suffering from heart failure instinctively and consistently avoid sleeping on their right side, reporting a distinct sense of discomfort in this position. This instinctual aversion is your body's subtle yet urgent message that something within your delicate physiological balance is fundamentally amiss. A comprehensive study published in the European Journal of Heart Failure meticulously examined the relationship between sleep positions and cardiac health in patients with heart conditions. Their research unequivocally concluded that left-side sleeping was profoundly associated with superior blood flow stability and a demonstrably reduced strain on the heart throughout the overnight period. To illustrate this critical point in a real-world scenario, imagine an individual who has diligently managed their blood pressure for numerous years, with their medications stabilized and seemingly effective. Yet every single night, without fail, they unconsciously adopt a right-side sleeping posture. While they may experience no dramatic, acute symptoms that would immediately alert them to danger, their heart is relentlessly compensating, toiling far harder than it should, not just for a few nights, but for decades. This relentless, cumulative cardiovascular stress does not manifest on a routine daytime blood pressure reading, which might appear perfectly normal. Instead, its devastating consequence manifests unexpectedly as a stroke at 4 a.m., a silent thief in the night. If you identified yourself as a right-side sleeper earlier, it is absolutely crucial that you continue to pay close attention, as the third position might also directly pertain to your habits. The third hazardous sleeping habit involves using an excessive number of pillows, 2, 3, or even 4, stacked high beneath your head. Many individuals adopt this practice under the misguided assumption that it will alleviate issues such as breathing difficulties, acid reflux, or promote better sinus drainage. And while a slight degree of elevation can indeed be beneficial for some of these conditions, the profound danger lies in excessive elevation, a consequence that very few discuss. When your head is propped up too high, your neck is forced into an unnatural, dramatic forward bend rather than a gentle, healthy curve. Coursing along both sides of your cervical spine are the vertebral arteries, critically important blood vessels that are solely responsible for supplying oxygenated blood to your brainstem and your cerebellum, the vital command centers of your brain that meticulously govern balance, coordination, and your very consciousness. When your head is pushed unnaturally far forward by a towering stack of pillows, these indispensable arteries become alarmingly compressed. You may not perceive this compression in the immediate moment, but over a prolonged period, chronic restriction of these vessels significantly diminishes the delivery of oxygen and vital nutrients to these profoundly important brain regions. Have you ever awoken with an uncomfortable stiff neck accompanied by a persistent, dull ache radiating from the base of your skull? This sensation is often dismissed as mere muscle tension or a result of sleeping, quote, the wrong way. However, it is frequently a direct manifestation of restricted blood flow. A study published in the Journal of Manipulative and Physiological Therapeutics delved into the profound impact of neck posture on vertebral artery blood flow. Their research unequivocally demonstrated that extreme forward bending of the neck measurably and significantly reduced arterial flow. While that particular study did not specifically focus on sleep, the fundamental physiological principle remains identical. If your neck is held in such a compromised and unnatural position for a full 8 hours, night after night, the cumulative detrimental effect on your brain's blood supply becomes substantial and gravely concerning. A recurring pattern observed frequently in clinical practice involves individuals who consistently awaken each morning plagued by neck pain and a headache. They often attribute these symptoms to the vague notions of quote-unquote stress or simply getting older. Yet when these same individuals are advised to switch to a single, properly contoured pillow that supports the neck's natural curve, their symptoms often miraculously disappear within a mere week. One correctly chosen pillow can make such an extraordinary difference. But we have only just begun to uncover the dangers, as the second position on our list raises even more serious concerns. The second highly concerning sleeping position is adopting a tightly curled fetal posture. This position is undeniably one of the most widespread, particularly among older adults, often chosen for the feelings of protection, safety, and instinctive comfort it seems to offer. However, from a rigorous physiological standpoint, this seemingly benign posture inadvertently creates two profound and detrimental problems for the body. Firstly, and crucially, your lungs are unable to fully and efficiently expand. When you curl tightly, drawing your knees up towards your chest and tucking your chin deeply downwards, your rib cage undergoes significant compression. Consequently, every single breath you draw throughout the entire night is shallower, less substantial, and far less efficient than it ought to be. Have you ever experienced that peculiar sensation upon waking where you feel an immediate, almost desperate need to take a truly deep, expansive breath, as if your chest has been held in a constricted vice for hours? This is a direct consequence of your lungs having been forced to operate in a severely restricted state for the duration of your sleep. When the intake of oxygen drops, even by a seemingly modest 10 to 15%, your crucial blood oxygen saturation inevitably decreases. For anyone already contending with underlying cardiovascular issues or the subtle onset of lung disease, this chronic reduced oxygenation places an enormous and unwarranted stress on both their heart and their brain, potentially accelerating the progression of existing conditions or triggering new ones. Secondly, the tightly curled fetal position subjects your neck and upper back to a state of constant, unrelenting tension. The muscles in these regions remain perpetually contracted, inadvertently compressing the myriad of small, delicate blood vessels that course around your cervical spine and the base of your skull. This sustained compression directly impedes and reduces the critical blood flow to your brain. Groundbreaking research published in respiratory physiology and neurobiology journals has conclusively demonstrated that body positions involving significant spinal flexion, such as the fetal position, demonstrably reduce tidal volume, the precise amount of air you inhale with each breath. Over the course of an entire night, these countless shallow breaths accumulate, depriving the brain of essential oxygen. It is common for individuals in this position to awaken feeling foggy, perhaps with a persistent dull headache or a touch of dizziness, often attributing these symptoms simply to sleeping poorly. In reality, their brain has been silently suffering from hours of oxygen deprivation. The necessary adjustment to mitigate these risks is far from complicated, and its exact implementation will be detailed comprehensively at the conclusion of this discussion. But first, we must confront the number one most dangerous habit, a routine that tragically combines multiple risk factors into one profoundly perilous nightly practice. If you are currently engaging in this habit, it is absolutely vital that you cease it tonight. The number one most perilous nightly habit involves going to bed within 2 hours of consuming a large meal, or even more dangerously, drinking alcohol. It is acknowledged that this particular habit resonates deeply with many, as evening dinners and social drinks are often ingrained aspects of modern life. However, from a critical cardiovascular perspective, this combination represents the single most dangerous practice on this entire list. Here is the complex physiological cascade that unfolds. When you consume a large, heavy meal, your body's sophisticated internal mechanisms immediately redirect a substantial volume of blood flow towards your digestive system to facilitate the arduous process of breaking down food and absorbing nutrients. While this redirection is a perfectly normal and essential physiological response, it simultaneously means that considerably less blood is readily available for other vital organs, including your brain and your heart. In younger, healthier individuals, the body possesses sufficient compensatory mechanisms to manage this temporary redistribution without significant detriment. However, in older adults, particularly those with pre-existing conditions such as narrowed or stiffened arteries, this sudden and significant redistribution of blood flow can trigger alarming symptoms, including profound dizziness, a sensation of debilitating lightheadedness, and in severe cases, even fainting during the vulnerable hours of sleep. Now, compound this challenge with the addition of alcohol. Alcohol, as a potent vasodilator, causes your blood vessels to relax and expand, leading to a sudden and often significant drop in your blood pressure. For individuals with robust, healthy, and flexible blood vessels, this effect might simply manifest as a pleasant sensation of relaxation or drowsiness. But for seniors, particularly those contending with arterial plaque buildup or stiff, inelastic arteries, This sudden and precipitous drop in blood pressure triggers a compensatory response from the body, often an overcorrection. The body frantically attempts to stabilize the pressure, leading to volatile fluctuations where blood pressure spikes sharply only to plummet again. These wild, erratic fluctuations exert immense stress on the delicate vascular walls, weakening them over time and increasing the risk of rupture. Moreover, in regions where blood flow becomes turbulent and erratic, the conditions become ripe for the formation of dangerous blood clots. The truly terrifying aspect of this entire cascade is that every single one of these potentially catastrophic events is unfolding silently and imperceptibly while you are entirely unconscious and utterly defenseless. The American Journal of Hypertension has conducted exhaustive research examining the intricate relationship between alcohol consumption and nighttime blood pressure patterns. Their studies conclusively revealed that even moderate alcohol intake consumed close to bedtime profoundly disrupts the normal and crucial blood pressure dip that should naturally occur during sleep, a physiological phenomenon vital for cardiovascular recovery. When this natural protective dip fails to materialize, the cardiovascular system strain escalates dramatically, increasing the risk of adverse events. To vividly paint a picture of this scenario, imagine an individual who concludes their dinner at 8 p.m., enjoys 2 glasses of wine, and then retires to bed at 10 p.m. At 2 a.m., they suddenly awaken, afflicted by a pounding headache, a racing heart, and drenching sweats, mistakenly attributing these alarming symptoms to a bad dream. In reality, they are experiencing a profound circulatory crisis, a desperate attempt by their body to compensate for the combined assault of a heavy meal and alcohol consumption. Over time, these recurrent nocturnal episodes accumulate, leading to subtle small vessel damage and even microstrokes that pass entirely unnoticed. Then, one fateful night, the event is no longer micro. If you choose to implement no other recommendation from this invaluable video, changing this singular habit holds the most immediate and profound impact. Make it a steadfast rule to finish dinner a minimum of 3 hours before your intended bedtime. If you choose to consume alcohol, ensure a substantial buffer of 4 to 5 hours before you attempt to sleep. Furthermore, after dinner, engage in a gentle 15-minute walk, simple, consistent movement. This seemingly minor adjustment alone possesses the power to reduce your overnight stroke risk more effectively than many prescribed medications. Having meticulously outlined the 5 dangerous positions and habits to rigorously avoid, let us now pivot to the profoundly beneficial alternatives, the practices you should actively embrace. The first recommended position is left side sleeping, and what follows is a piece of crucial information that many medical professionals, surprisingly, may not even be aware of. As previously mentioned, your heart is situated slightly to the left of your body's midline. When you consciously choose to sleep on your left side, the force of gravity, instead of acting as an impediment, becomes a powerful ally, actively assisting the natural flow of blood. This gravitational assistance means your heart is required to work less strenuously, blood circulates more efficiently throughout your entire system, and consequently, your brain receives a more generous and consistent supply of oxygen. This constitutes the foundational principle of basic cardiology. However, a groundbreaking discovery made approximately a decade ago elevates the importance of left-side sleeping to an entirely new paradigm, the identification of the glymphatic system. Envision this remarkable system as your brain's highly sophisticated and indispensable waste disposal mechanism. Throughout the nocturnal hours, while you are in a state of deep unconsciousness, the glymphatic system diligently works to flush out harmful toxins, metabolic waste products, and, critically, misfolded proteins such as amyloid beta and tau, the very proteins strongly implicated in the pathology of Alzheimer's disease. A seminal study published in the prestigious Journal of Neuroscience conclusively demonstrated that the glymphatic system operates with optimal efficiency when an individual sleeps on their side, and particularly on their left side. To dissect this further, every single day, your brain's metabolic activities generate and accumulate proteins like amyloid beta and tau. In patients afflicted with Alzheimer's disease, these proteins tragically build up, forming dense neurotoxic plaques that impair cognitive function. Conversely, in healthy brains, the glymphatic system functions as the nocturnal janitor, meticulously clearing these deleterious proteins during sleep. But if you persistently sleep in a position that impedes or restricts the efficiency of this crucial clearance mechanism, those harmful proteins will inevitably begin to accumulate. This accumulation does not manifest overnight. It is a slow, insidious process that unfolds over years, indeed over decades. By the time the overt symptoms of cognitive decline or neurodegenerative disease finally appear, the underlying damage is often extensive and regrettably largely irreversible. Therefore, left-side sleeping is not merely about preventing a stroke tonight. It is a profoundly proactive strategy for safeguarding your cognitive faculties and preventing cognitive decline 2 decades into the future. Furthermore, there is an additional, immediately tangible benefit. For individuals who frequently contend with the discomfort of acid reflux, the specific anatomical arrangement of your stomach and esophagus is such that left-side sleeping helps to keep stomach acid contained and prevents it from refluxing upwards into the esophagus. You are thus more likely to awaken without that unpleasant burning sensation in your chest. Understandably, if you have spent 30 years sleeping on your right side or your back, transitioning to left-side sleeping will require a conscious adjustment. The practical solution for this transition is remarkably simple and effective. Embrace the use of a body pillow. Hugging a body pillow firmly in front of you provides gentle support and physically helps to maintain your left side position throughout the night. It also offers excellent spinal alignment, and if you experience joint pain, placing a smaller supportive pillow between your knees can further alleviate discomfort. A common and valid question that arises is, what if I roll over in my sleep? It is entirely normal and expected that you will occasionally shift positions or roll over. The objective is not to achieve absolute, unwavering perfection in your sleep posture. Rather, the goal is to significantly increase the proportion of time you spend in an optimal, beneficial position, thereby reducing the cumulative hours spent in a harmful one. However, there exists a second, equally effective position that proves incredibly beneficial for specific individuals and circumstances. Let us now explore the second. Highly recommended sleep position, back sleeping, but crucially with gentle elevation. This is not about sleeping completely flat, nor is it about sitting bolt upright. Instead, it involves a gradual and consistent incline that raises your entire upper body by approximately 15 to 30 degrees. This precise elevation can be achieved through various means: the strategic use of a supportive wedge pillow, the luxury of an adjustable bed, or even by carefully stacking and arranging multiple pillows to create a stable, continuous slope. The paramount distinction here is that your entire upper body is elevated, not merely your head, which avoids the neck compression issues discussed earlier. Why is this specific configuration so remarkably effective? There are 3 compelling reasons. Firstly, and of great cardiovascular importance, blood returns to your heart far more efficiently from your lower body when gravity is harnessed to assist the venous return. If you frequently suffer from poor circulation, persistent swollen ankles, or the discomfort of varicose veins, this elevated back position significantly reduces the workload on your cardiovascular system during the restorative hours of sleep, promoting better venous drainage. Secondly, this gentle elevation effectively decreases the pressure inside your skull. For individuals with inherently fragile brain vessels or those struggling with uncontrolled high blood pressure, this reduction in intracranial pressure substantially lowers the risk of small vessel rupture. These microscopic hemorrhages, often imperceptible in the short term as they rarely cause dramatic acute symptoms, accumulate silently over years, leading to insidious cognitive decline, pervasive memory issues, and what medical professionals classify as vascular dementia. Thirdly, and of significant respiratory benefit, breathing improves markedly in this elevated back position. Your airway naturally remains more open and unobstructed. If you contend with mild sleep apnea, chronic nasal congestion, or bothersome sinus issues, this elevation can dramatically reduce snoring, allowing for a more consistent and improved delivery of oxygen to your brain throughout the night, leading to more restorative sleep. Now, here is a subtle yet crucial detail often missed. If you choose to elevate your upper body, it is equally important to place a small supportive pillow beneath your knees. This seemingly minor addition serves to maintain your spine's natural, healthy curve, effectively taking pressure off your lower back and ensuring comprehensive comfort and alignment. This synergistic combination of upper body elevation and knee support creates what is famously referred to as the zero gravity posture. This posture was extensively studied by NASA for its astronauts as it optimally distributes pressure evenly across your entire body, dramatically reducing strain on both joints and blood vessels. However, it is imperative to state with absolute clarity that this elevated back position is not universally suitable for everyone. If you suffer from severe sleep apnea, even with elevation, back sleeping might still predispose you to airway collapse. In such cases, left side sleeping would be the superior and safer choice. If you experience chronic shoulder arthritis, this position might offer significant relief by reducing direct pressure on the joints. Conversely, for those with heart failure, left side sleeping is generally considered the ideal and most protective position. The fundamental takeaway here is not to adhere blindly to a rigid rule, but rather to deeply understand the underlying physiological principles that explain why these positions work, and then judiciously apply that understanding to your own specific health situation and unique needs. Have you experimented with either of these two beneficial positions? Experience is valuable. Share in the comments whether left side or elevated back sleeping works best for you. Beyond specific sleep positions, the environment of your bedroom plays an equally critical, often underestimated role in your nocturnal health and your overall stroke risk. Your bedroom is not merely a place where you momentarily close your eyes. It is the vital sanctuary where your brain and heart either undergo profound recovery and rejuvenation, or conversely, silently deteriorate. Let's start with temperature. It is paramount to maintain your bedroom environment within a cool, optimal range, specifically between 64 and 68 degrees Fahrenheit. A cooler ambient temperature facilitates a natural drop in your core body temperature, a physiological trigger essential for initiating and sustaining deep, restorative sleep stages. Furthermore, a cooler room naturally lowers your nighttime blood pressure, thereby reducing undue strain on the delicate vessels within your brain. Conversely, if your room is excessively warm, your body is compelled to expend additional energy to regulate its temperature, preventing you from sinking into the deeper, most beneficial sleep stages. In a warm environment, your heart rate remains elevated, and you never truly enter the profound recovery phases, where genuine cellular healing and systemic repair can occur. Next, the ubiquitous presence of blue light demands immediate attention. It is crucial to rigorously eliminate all sources of blue light after 9 p.m. This includes smartphones, tablets, televisions, and even harsh overhead lighting. Blue light, with its specific wavelength, is a potent suppressor of melatonin, the crucial hormone that signals to your body that it is time to sleep. Suppressing melatonin invariably delays the onset of deep sleep stages, those very stages where your brain efficiently clears metabolic waste products and your cardiovascular system stabilizes and rebalances. If the use of a device is absolutely unavoidable, invest in high quality blue light blocking glasses or activate your device's night mode setting. Better yet, embrace the timeless practice of reading a physical book, allowing your brain the essential wind down time it desperately needs, free from the stimulating glow of screens. Thirdly, proper neck support is not merely a matter of comfort, but a critical health imperative. We previously discussed the dangers of inappropriate pillow height. This factor holds far greater significance than most people realize. A memory foam pillow with a precisely designed cervical contour is ideal, as it cradles and supports your neck's natural curve without forcing your head into unnatural or compromising angles. This single adjustment can by itself prevent the restricted blood flow through the vertebral arteries, a direct pathway to your brainstem and cerebellum. Finally, noise, even subtle, seemingly innocuous sounds, can be a silent saboteur of your sleep quality. Even sounds that do not consciously awaken you can still jolt you out of deep sleep stages, triggering a cascade of physiological stress responses. Your heart rate can spike, and cortisol, the stress hormone, increases. These are what Dr. Clark refers to as micro-stress events. You may not consciously remember them, but your vascular system registers and responds to every single one. To counteract irregular noise, consider utilizing a white noise machine or simple earplugs. These tools can create a consistent, soothing sound backdrop, effectively masking disruptive, intermittent noises. These recommendations are not optional luxuries. They are fundamental variables that directly and profoundly influence your stroke risk. To truly empower yourself and proactively manage your nighttime health, consider taking your commitment a step further by actively tracking your nocturnal well-being. Your body, with its innate wisdom, constantly provides subtle signals even as you sleep. The challenge lies in learning how to accurately interpret them. The first valuable option is an overnight pulse oximeter. This small, unobtrusive device clips comfortably onto your finger and continuously monitors your oxygen levels throughout the entire night. If your blood oxygen saturation repeatedly drops below 92%, this is an unequivocal red flag. Such persistent desaturation could be indicative of underlying sleep apnea, compromised circulation, or broader respiratory issues, all of which are established risk factors for stroke. This objective data is invaluable to share with your physician, particularly if you are experiencing unexplained warning symptoms. Secondly, heart rate variability, HRV, tracking offers a powerful insight into your autonomic nervous system's function. Many modern smartwatches or specialized sleep rings are equipped to measure HRV during sleep. A consistently low HRV overnight is a critical indicator of systemic stress, chronic inflammation, emerging blood pressure irregularities, or underlying metabolic dysfunction. It serves as an early warning signal that your body is not adequately recovering and restoring itself during sleep. Thirdly, and perhaps most accessible, practice of maintaining a simple sleep journal. Each morning, take a few moments to meticulously record how you feel. Note any headaches, sensations of dizziness, numbness or tingling anywhere in your body, or feelings of brain fog. These seemingly subtle symptoms can be crucial early indicators of poor oxygenation or restricted circulation occurring during sleep. Recognizing consistent patterns in your journal entries can be immensely helpful for both you and your doctor in identifying underlying issues that might not manifest during a single brief office visit. Now, a critical point must be unequivocally emphasized. These self-monitoring tools are intended solely for personal awareness and educational purposes. They are under no circumstances a substitute for professional medical evaluation, diagnosis, or treatment. If you observe concerning patterns, if any symptoms persist or worsen, or if you possess pre-existing stroke risk factors, it is absolutely essential to discuss these observations with a qualified healthcare provider. Self-monitoring is undeniably valuable, but it is not and never will be a replacement for expert professional medical care. What these tools do provide you with, however, is invaluable data, a greater sense of control, and heightened awareness. You are no longer navigating your health blindly, relying on guesswork. You are now equipped with measurable insights. Let me illuminate why most people rarely encounter this profoundly vital information. The intricate subtleties of sleep position and its physiological ramifications simply do not fit neatly into the confines of a standard medical appointment. There is no conventional blood test for optimal sleep posture, no imaging study that can diagnose a poor sleeping habit, and certainly no pharmaceutical prescription that can magically correct it. In a typically brief 15-minute consultation, your doctor is understandably focused on reviewing laboratory results, adjusting existing medications, and addressing acute, pressing symptoms. The nuanced topic of sleep posture, unfortunately, rarely makes it onto the standard checklist. Yet, the burgeoning body of research is unequivocally demonstrating that sleeping in certain positions can silently and profoundly impact crucial blood flow, oxygen delivery to the brain, pressure dynamics inside your skull, and your brain's intrinsic capacity to efficiently clear toxic proteins. These are not dramatic, sudden events. Rather, they are insidious, cumulative processes, silently building night after relentless night, year after relentless year, for individuals over the age of 60, and indeed for anyone actively managing chronic blood pressure issues or other cardiovascular conditions. These often overlooked nighttime habits transition from minor lifestyle choices to absolutely critical determinants of long-term health and survival. And here lies the most empowering and often missed aspect of this entire discussion. You do not require a costly prescription, nor do you need to undergo expensive, invasive treatments. What you fundamentally need is heightened awareness and the courage to implement one or two targeted, deliberate adjustments. Consider changing just one habit, perhaps shifting to left side sleeping, or ensuring you finished your evening meal a full 2 to 3 hours before bedtime, or simply replacing a stack of multiple pillows with one properly contoured pillow. Any single one of these seemingly minor changes possesses the measurable power to profoundly improve how your cardiovascular system functions during sleep. You are not merely reducing your immediate stroke risk. You are making a profound long-term investment in your brain longevity, in maintaining cognitive clarity, and in bolstering your overall cardiovascular health for the next 2 to 3 decades of your life. By investing your time watching this comprehensive video, by diligently taking the effort to understand these intricate physiological connections, you are already more informed and better equipped than 95% of the general population. You are actively seizing control over variables that are entirely within your power to change and optimize. You now possess invaluable information that most medical professionals will not typically discuss in a routine appointment, information that holds the potential to genuinely protect your precious brain starting as soon as tonight. This is not a minor insight. It is profoundly significant. Therefore, here is the immediate call to action for you today. Select just one adjustment from the comprehensive array of strategies we have covered. Perhaps it is the commitment to left side sleeping. Perhaps it is the disciplined practice of finishing dinner 3 hours before retiring for the night. Or perhaps it is the simple yet effective switch to a single anatomically contoured pillow. Begin there. Make that one deliberate change. Commit to it for a period of 7 days. During this week, pay meticulous attention to how you feel each morning. Observe if your headaches begin to decrease. Notice if your energy levels demonstrably improve or if you feel mentally sharper, more focused. Your own body will provide undeniable feedback, unequivocally telling you if this change is working. Now, take a moment to drop a comment below. Which specific habit are you committed to changing first? Your shared answer might very well illuminate a previously unconsidered pattern for someone else, potentially inspiring their own life-saving adjustment. If this video has delivered information you genuinely have never heard before, please hit that like button to show your appreciation. And more importantly, share it widely with someone you know who profoundly needs to see this. Someone over 60, someone actively managing their blood pressure, or anyone who consistently wakes up with unexplained, troubling symptoms. And here is a compelling reason why you absolutely need to subscribe right now. Next week, Dr. Clark will be revealing 5 specific, clinically studied foods that have been scientifically proven to reduce stroke risk by an impressive margin of up to 30%. This is not vague, generic dietary advice. These are precise foods recommended in specific amounts. And here is the truly fascinating part. You very likely have at least 3 of these powerful foods already in your kitchen, but you are almost certainly not utilizing them correctly for their maximum stroke protective benefits. This is cutting-edge research and invaluable information that most people will never encounter, data that will not typically surface during a standard doctor's visit, yet it possesses the profound potential to genuinely transform your health trajectory. Hit that subscribe button now and be sure to turn on notifications, because if this information was valuable to you, next week's video is destined to be even more critically important. Until then, remember to sleep smart, stay informed, and always diligently protect your precious brain. Dr. Arthur Clark will see you in the next installment.